My name is Sarah Cahill. I'm from Salt Hill in Galway. I am a GP and have a special interest in women's health. I recently started my own weekly women's health clinic, and I am a mother to two daughters who are 9 and 7 years old. Studying medicine wasn't really even on my radar when I was in school. I studied for a degree in science after I finished school. I had an interest in an academic career in science, but in the end, instead of opting for a PhD, I did a 1-year taught master's in biomedical science. At that point, I thought it would help me get a job in the medical device industry. After that, I travelled for a year, and then when I came home, I got a job in industry. So I worked there for a couple of years as a product development biochemist. Then an opportunity arose in the Regenerative Medicine Institute in NUI Galway in the area of stem cell research. So I enjoyed that, and while it was kind of adjacent to the medical field, I really was looking for something that had some actual patient contact. So I considered lots of different things. I considered nursing for a while. I did some courses in nutrition. I applied for occupational therapy in NUI Galway and was offered a place, but turned it down. And then eventually the graduate programs in medicine started coming on stream. So I applied and got a place in the University of Limerick and started my degree there in 2009. In the graduate medical programme in the University of Limerick, we spent 2 years based in the university and another 2 years rotating around different hospital and GP posts. Compared to a lot of the other universities, we actually had a longer stint in general practice. We had 18 weeks compared to a lot of universities only having 2. And it was during this time in general practice that I developed an interest in it. I just liked the variety, and I liked the degree of autonomy that GPs appeared to have compared to some other hospital specialties. After I finished college, I did my intern year and I worked in some medical jobs before ultimately deciding on doing GP as a career. To be honest, part of the consideration was that it is a shorter path to completion compared to a lot of medical or surgical specialties. It is a 4-year programme. We rotated around different medical specialties, as well as like pediatrics and obstetrics and gynecology and psychiatry. And then we spent 2 years in general practice posts, so a year in 2 different practices. I had 2 small children at the time when I started the GP programme, and so that was a big consideration. I think that general practice offers a degree of flexibility that other specialties don't. Even though I did a rotation in obstetrics and gynecology as a medical student and worked as an obs and gynae junior doctor as a GP trainee, it wasn't really until I was in general practice as a GP registrar that I really developed an interest in women's health. While you are a junior doctor in obstetrics and gynecology, you're working alongside other junior doctors who are actually training to become obstetricians. So some aspects of the job I really enjoyed, like the antenatal clinic, for example. But on the flip side, I assisted in a lot of, say, cesarean sections and different surgical procedures, which wasn't really a skill I need as a GP, although it is still useful to be able to explain to patients what to expect if they're undergoing those procedures. But yeah, as a GP reg, that's when I really developed my interest. So part of the curriculum was to do a course in contraception. I learned how to perform a cervical smear, for example. I learned how to insert coils and implanons. And so that's where the interest started. Then when I finished the GP scheme, my plan had always been to take a few months off before I started applying for jobs, just because I'd been so busy in the few years of the scheme. But then a job arose in the family planning clinic just 1 day a week. So I went for that because I just thought it would be right up my street. So I started working there just 1 day a week, and obviously while I was there, I got much more experience and just became much more proficient at all the different skills. I also did some courses such as the Irish College of General Practitioners course in menopause. I also then started working as a GP alongside in the family planning clinic, and I've worked in a few different GP practices now and see all the women's health aspects that are in GP as well. In the practice I'm in at the moment, I'm the only female GP, so I get a lot of experience in that area as well. So in general practice, we generally offer 15-minute appointments, and that's usually adequate for most things. But I just feel there are certain things that really cannot be adequately explored in 15 minutes. So that, along with my interest in women's health, is what's led me to develop my women's health clinic. So what I hope to be able to offer is just a real in-depth exploration of a woman's concerns about their health. And say, for example, in the case of a lady who might come to see me about her menopause, I really need to be able to take the time to adequately risk assess her. So look at her breast cancer risk, her cardiovascular health risk, and her risk of osteoporosis. And then, we need to be able to take the time to go through the various treatment options available, and so that she feels she has enough information to make a really informed choice. So the kind of patients who might come to see me are, for example, women whose GP might not offer a particular service. For example, some GPs don't insert coils, or some women just feel more comfortable attending a female GP about certain things. So yeah, that's the type of scenarios where people might choose to see me rather than their regular GP. I suppose there's certain things I can't do and certain things I'm not offering. So I don't have a GMS number, so I can't offer free appointments to patients who have medical cards or GP visit cards. I don't have any of the other state contracts either, so I can't offer antenatal care, cervical screening, free visits for under sixes, or the free contraception scheme for 17 to 25-year-olds. But what I can offer is, I hope, a really in-depth discussion with women about their concerns, and just time really to be able to come up with a treatment plan that they are really happy with. I have done a highlight on it before on Instagram, but just to reiterate specifically the kind of things I can offer you in the clinic. So in terms of contraception, we can talk about different options such as combined pills or patches, progesterone-only pills, other progesterone-only options such as the Depo-Provera injection, the Implanon, or the bar as it's known sometimes, the hormonal coils such as the Mirena, the Kyleena and the Jadess, copper coils, and the new Ballerine copper ball. So that's contraception, and then we can talk about menopause as well, perimenopause, menopause, the symptoms you might be getting if you're not sure whether it is the perimenopause, different management options that are available, so whether it's HRT or just kind of lifestyle changes, or just other ways to manage your symptoms. Any gynecological concerns you might have, so heavy periods, painful periods, abnormal bleeding between periods, discharge that you're concerned about, or really anything that is bothering you. Or if you have a specific diagnosis that you either have or you think you might have, we can talk about that as well. So for example, PCOS, that's polycystic ovarian syndrome, endometriosis, fibroids, and so then finally, in terms of fertility, so I'm not a fertility consultant, I'm not a gynecologist, but I can do some kind of initial investigations for women. So if you're planning on trying to conceive, women often wonder what if anything they should do in advance. So we can just look at your general health, make sure it's as good as it can be. Sometimes we need to do bloods just to make sure that there's nothing easily reversible that might make things more difficult in terms of trying to conceive. And then the other thing is that if you have been trying to conceive without success for some time, I can do the kind of initial investigations. So yeah, those are the kind of things I can offer. And if you have any questions about whether your particular problem is something I might be able to help with, you can pop me an email to info@lifecycleclinic.ie and I'll get back to you as soon as I can.